Okay, final segment. This is being presented due to popular demand. I have a lot of patients ask me all the time, Doc, I understand I need to do stretching, I need to strengthen, I need to build stamina, I need to do all that stuff and work out. I don't have time. Anyone feel that way? I know I do sometimes. Well, the truth is, it doesn't take a lot to build strength. If you go back to my initial presentation on this DVD, I made the point that it's much more important as we get older to be strong and flexible than it is to have all this endurance. Okay, so if you're a marathon runner, you're a high-level rower, you're a cross-country skier, you're doing endurance things, that's fine. More power to you. I encourage that. I do it myself. Most people don't have the time, and frankly, a lot of people lose the willingness to be dedicated because of life factors. But what I'd like to do in this segment is just give you a very, very quick workout that you can do without any equipment you're going to see. I'm going to do it right in this little space on the floor. You can do it in the living room. Some people have a rec room. You can do it in the bedroom. I don't really care where you do it. But all I need is about a 6-foot square space to do all this exercise. Body weight exercises are probably the best way to build strength. A lot of people, when they think about weightlifting or strength training, they think of bodybuilding because we've seen Arnold Schwarzenegger and all those guys getting all beefed up. The real truth about that type of muscle is it's very dysfunctional muscle. I'll have a lot of people arguing me on this point, but that's okay. But the truth is, it's very dysfunctional muscle. It's sort of ballooned up. It's very stiff. Think of just inflated muscle with a lot of water density. However, if I looked at a real power lifter, the Olympic level power lifters, or if I looked at a gymnast or somebody like that, their muscles aren't just sort of inflated, they're more like a piece of dense plywood. And what happens over time is they're using a lot of, their lifting technique is completely different. But especially a gymnast or somebody who's doing more body weight exercises, some of the strongest wrestlers I've seen have been guys who don't get into the weight room, but they just hammer out hundreds and hundreds and thousands of repetitions of body weight exercises. I'm going to show you a few very key ones that are going to increase strength incredibly. They will also dynamically work on stretching your body, and they're working on developing the core structure. So everyone's talking about core development, Pilates, yoga, and all that. Great stuff. If you want to do it, more power to you, go after it. In this segment, I'm just trying to give the busy person who doesn't have time to go do all that stuff for a couple of hours a week what they can do in a few minutes every single day, and you can do it right at the end of the stretch. I do it every morning or at night, whichever one, as an adjunct to my normal routine, but I do it after I stretch. So I stretch and then I strengthen. I've already got the muscles warmed up and then I go into strengthening. Okay? So what I'm going to show you is I'm going to show you what's known as a Hindu push-up. It's not a traditional push-up. We'll actually start with a couple of traditional push-ups. Then we're going to go into the Hindu push-up, which again works on really developing the strength along, functional strength and flexibility along the whole spinal column, the shoulder girdle, the hips, the buttock, the hamstrings. Okay? Once we go from there, then I'm going to show you, it's actually bridging. And a lot of people think, oh my goodness, I couldn't do bridging. Well, there's ways that you can build into the bridge. But when you go into extension, if you go back to my original presentation, everything we do is in flexion. We need to neurologically reinforce or physically reinforce the neurology that takes us into extension in order to really resist the forces of gravity, the force of gravity. But we need to do that in order to keep our body optimally healthy, because posture really does drive everything else. If I have this kind of posture, I've just lost 30% of my ability to oxygenate my lungs. That's 30% less oxygen into the cells of my body. I've also just compressed, mechanically and physically compressed my heart, my lungs. My heart's going to be having to work a lot harder to get that circulation going, so my blood pressure goes up. I've just compressed my digestive tract. I've just tractioned the vagus nerve, which is a nerve that goes straight from the brain, and it innervates all the different structures internally, your swallowing reflex, everything down into your heart, lungs, and esophagus, and I've just compressed that. Well, that leads to a lot of acid reflux and conditions like that. So posture is really going to drive a lot of this. So first thing, if we do a straight push-up, most of us know how to do it. If you can do a push-up, great. If not, you'll do a beginner's push-up, and you're going to build yourself up into this. I'm just going to show you the exercises. I'm not going to put it into a routine, but I will tell you that if you can do 100 Hindu push-ups and 200 Hindu squats every single day, and a neck bridge, and you can hold it for at least 2 minutes, get up to 3 if you can, you're going to be more powerful and you're going to feel more injury resistant than you ever have. But it's going to take you time. Some of you, you're going to whip through it very quickly, and others it's going to take you a year to get to that point. All I want you to do is a little baby step every single day. Okay, so it's a progressive thing, but that's the beauty of using body weight exercises. If you want a harder workout, you just do more repetitions. You can break it into sets, but the repetitions over time is what's critical. So, in a regular push-up, what I want the body to be in a straight position, okay? A lot of people do push-ups like this. You know, that's not really doing a push-up, okay? I'm not holding my core structure. But if I hold myself like this with my head forward, I'm ramrod straight. I'm having to use all those deep little muscle structures in order to hold this position. Then I'm just simply going to drop myself down and then push myself up. Now, the breathing cycle is important with this because I want to exhale on the way down. Inhale on the way down and exhale on the way up. Okay? Inhale on the way down, exhale on the way up. So it'll look like this. I'll do about 5 or 6 of them. But the breath cycle is really critical. So I'm going to go. Now, if you get that breath cycle going, it's almost like a meditation. You're actually working an energetic cycle that is very efficient, that a lot of people are doing Qigong or Tai Chi. This is kind of like, think of this as kind of power Tai Chi. The breath cycle tied in with your exercise cycle is going to work your lungs, it's going to oxygenate the muscles better, and you'll be able to get more repetitions, okay? So that's a basic push-up. Now, if you're not able to do that, what I have people do is just a knee push-up. All you're going to do, you're going to keep your legs bent like this, and you're just going to rock down into this position and come back up, okay? Most people can handle that. Now, I've actually had 79, 80-year-old women who could only do maybe 2 repetitions of that. And I say, that's fine. Once you do that, then you rest. You let your body kind of relax. Could be for 30 seconds, could be for a minute. And you do 2 more. And you just go down and push up, okay? Go down and push up. That's it, okay? That's a basic push-up. Now, that's not just working your chest and your shoulders. It's working the whole body if you really get the body held in a core structure like that. Now, the Hindu push-ups. These are incredible push-ups, and they're called Hindu push-ups because they were done by Indian wrestlers years and years ago. They still do them. And the myth is that they would pump out probably 2,000, 3,000, 4,000 of these in a day. I don't know if it's so much a myth. It may be real. But that's a lot. And you would have to work for a long time to get to that point, but I don't ever say anything's impossible. My goal is to get you to be able to do just 100 of these. If you can't even think of that goal, then set a goal of 20, okay? But the idea is set a goal, work to reach that goal, don't get frustrated. You can do these exercises every single day. That's the beauty of it. This whole idea of bodybuilding and, well, I've got to work out, one body part 1 day or 2 days a week and all the rest and everything. You don't need to do that with body weight exercises. Now, if it gets to the point where you're just exhausted and it hurts because the muscles are so tight, take a day off, okay? But I suggest that people do this 5 days a week and take 2 days off, let your body recover. But with body weight exercises, you can do it over and over and over. Think about a chimpanzee or a baboon or a gorilla. They don't go swinging from the trees or running around the mountainside and then say, oh man, yesterday I had a really tough day, so I think I'll take a day off and let it rest. They've actually, over time, just evolved. They just do what is required of them, and they build incredibly dense muscles. Think of bricklayers. Think of blacksmiths. I mean, they've got these huge forearms and thick, dense hands, and they couldn't not do that. They couldn't rest between heavy days and light days, okay? So the body it will adapt to the stresses you put on it. The key is to make it so you don't totally overstress it, and we do that by managing the repetitions that we do, okay? So a Hindu push-up, I'm going to show you kind of in an oblique angle here so you can get an idea. But my feet are going to be real wide like this. I'm actually sort of in a tripod position. My hands are going to be placed sort of right underneath my face, okay? I don't want them under my chest because I'm not going to be doing a push-up like that. But what I'm going to do now is I'm going to come back like this. I'm going to inhale and I'm going to scoop down like that and come into an arch like this. So it's a scooping arch, and then I pop back up, okay? Again, the inhale is as I'm going down, and I'm going to inhale, actually here. I'm going to exhale as I go through the power movement, okay? Inhale. Inhale. Exhale. Inhale. Exhale, okay? Now, to make it a little more difficult, I can bring my feet a little closer to my hands, okay? I always want to kind of be up on my toes, and I scoop down a little bit more and come back up like that. And you can see that if I just cranked out a bunch of these, I'm actually working a lot more muscles than just by doing a push-up. And a lot of people say, well, Doc, what about doing the lat work? Well, believe me, you go test your lat strength, your pulling strength, after you've done a bunch of, test it before, and then do these for a month, and then go test it, and you're going to have rapidly increased your pulling strength as well. You're working so many different muscles just to do that one exercise. Okay? So, regular push-ups, Hindu push-ups. Work on building those up. If you can only do 2 at a time, set a goal to do 10 a day. You're going to do 5 sets of 2. If that's too much, okay, let's go 6 a day. Okay? But the idea is build up to the point where you can do about 100 of those a day. Total. Now, if you want to do more than that, go for it. Okay? In fact, what I try to get people to do is once you've achieved that goal, set a new one. Keep progressing. The body's designed to adapt. Okay? That's a growth cycle. If you stop adapting, you're starting to die. Okay? So, next thing we'll do is we'll go into the neck bridge. Now the neck bridge, this may be very difficult for some of you to do initially. And it's also one of those things that a lot of people are going to say, well, I've had neck injuries and I can't do this. Well, fair enough. Here's what I tell people. If you have an acute injury that's under treatment right now, I don't want you doing this. If it's an old injury, I had a fracture at C7 when I was 17. I can do these, okay? So the idea is if you have an acute injury, I don't want you doing it. If you have an acute weakness in the neck, there's a way, and I'll show you in a little bit, how you can actually increase that flexibility of your spine without stressing the neck. You don't have to also do the neck bridge strictly. You can go into a body bridge, and I'll show you both versions. But what it's going to look like, I'm actually going to lie on my back with my heels tucked in pretty tightly. Now, if you're doing this in socks, sometimes it's better to be barefoot or to have shoes on so you don't slip, okay? But I've got enough traction here that I'm just going to do it in socks. I'm going to place my hands back here, and I'm going to kick up into a bridge. Now, I'm really balancing myself with my hands and my legs right now, and I'm going to curl myself up a little bit more, a little bit more. I haven't warmed up for this today, so you're going to see how I warm up. And I'm just going to kind of hold this. I'm actually pushing my pelvis up into the air.
and holding myself here. The objective is to actually move to the point where I can rock my nose as close to the ground as possible so that I can put the weight of my body on my forehead. And that way I don't put a lot of stress down on my neck. And this is how we can do it without any neck injuries, okay? And then I drop down into a rest position, all right? Now, this will work you. To get into that position, if you can't do it yet, I'll show you later how to do a wall walk where you'll work on that flexibility of the back. Now again, I've got a lot of people that say, well, Doc, I've got a disc herniation, I've had this injury, that injury. That's fine. I show them how I do it. I had a grade 3 disc herniation at 24, fractured neck at 17, and a fractured sternum at 17. I can do all these. It took a while to really get the flexibility, and I'm still not exactly where I'd like to be, but it's progressing and getting better and better as we go. But my strength, my core strength, is stronger than it ever has been using these very simple little techniques, even after years of trying to do specific core strengthening. So again, I'm actually going to take my socks off because I was slipping a little. And we're going to do another bridge. Now I'm going to demonstrate the body bridge, okay? If you feel initially that you're putting too much stress up on your neck or your head because you can't roll over, then we're going to go into a body bridge. And I always end with these anyway, whether I'm doing a neck bridge or not. But I'm going to come up like this, and you can see them up on my toes. And this time, I'm going to push up, and I'm really pushing with my arms, my legs, and you'll feel where the tension is going to build up. But I'm stretching my chest, and I'm going to walk myself back, and I'm trying to look down at the carpet. Then I drop to a neck bridge, and I'll hold that, and I just focus on my breathing. Good. And then back up into a stretch, and I'm really pushing, and then I tuck my chin, and I slowly drop back down. And you can see you're working when you do that, okay? But if you do that, and it may feel a little uncomfortable, it may put stress on muscles and bones and areas that have not been stressed. But the beautiful thing is, it may hurt a little bit because it's uncomfortable, but it's not causing any harm if you do it properly and you take your time. All right? All right, the next exercise is going to be what we call a Hindu squat. Now, again, there's going to be a lot of detractors to this. I don't worry about that because I've had so much damage to my body, and when I started doing this, it took a little bit of getting used to it, but once I did, all the joints, all the muscles, everything really started to engage, and my posture and my function became so much stronger that the detractors, I just tell people, try it and experience it, because you'll have a lot of, quote, experts saying, oh, you can't compress the knee that far and blah, blah, blah. Well, the truth is, the joint was designed to do this. So if we just look at the way the joints are designed and you do it properly, you're not going to have a problem. Now, a Hindu squat, again, I'll do it kind of obliquely so you can see, and then I'll show you from the side. What I'm going to do, this is actually working the legs and the lungs. Remember, the breath cycle is really important. But I'm going to have my hands out like this. I'm going to inhale, and I'm going to retract my hands back like this and really squeeze my fists. I'm going to do this in slow motion. Then I'm going to drop back. My hands come back. I squat down. Okay, see, I'm going straight down, but see how my heels come up? My heels actually come up, and I'm compressing down. This is where a lot of experts are going to complain. Well, I'm an expert too, and I'm telling you, this is not going to be a problem. And then you're going to swing your arms up, and you're going to come up as you exhale. So in real time, it'll look like this. From the side.
See how my back is staying straight and I'm swinging right through, and you will work your legs like you've never worked them. I'll show you from the front. My heels come up. Like that. Hindu squats. Again, if you do 200 of those a day, you'll feel it, okay? You may get a little dizzy, you may get a little hyperventilated if you first start this and you're doing it a little too fast. I was having to talk and breathe, okay, so it got me a little hyperventilated. But do those, you will gain a lot of power, not just in your legs, but that core stability, because as I'm coming down, my core muscles have to keep me stable and as I come up, okay? The breath cycle is really critical because that's working the lungs, engaging the diaphragm, and it gets a lot more oxygen into the system. That's a Hindu squat.